So, doctor, why are we talking about blood pressure so highly nowadays?
So the thing is that hypertension, many people have this opinion that it's an old disease. So this concept of hypertension being a benign condition is not true.
So, why is it called the silent killer?
Many a times people don't have obvious symptoms, reasons other than hypertension as well.
So, doctor, my next question is do apps and tools actually helps people in managing hypertension?
There are apps which also prompt you to take your medicines regularly or prompt you to take your BP readings, home BP readings regularly. So that's where digital health or digital tools are helping us.
So, doctor, what happened when BP is still high despite of lot of medications?
So there are terminologies like difficult to treat hypertension or resistant hypertension, which basically means that even after giving multiple medications, generally 3 or 4 medications to reduce BP, the BP still remains high.
So, lastly, doctor, what you want to tell our viewers?
What is the target BP that they should try to achieve? What is the overall cardiovascular risk that they are exposed to? How do they correctly measure their BP at home? What are the lifestyle measures that they should follow?
Hello, my name is Tanaya Bhattacharjee and I want to welcome all of you today. We have a very special guest with us today, Dr. Saujatya Chakarborti. Welcome,
Hello.
doctor.
Thank you.
So, doctor, my first question for today is what is hypertension?
So, thanks for having me. So, hypertension in simple terms means elevated blood pressure over and above the normal limits, which, if sustained over a period of time, can lead to bodily harm, damage to various organ systems, and various adverse cardiovascular effects in the long run.
So, doctor, why are we talking about blood pressure so highly nowadays?
So the thing is that hypertension, many people have this opinion that it's an old disease or it's a silent disease or it's mainly an innocuous condition. But the reality is not so actually. Even today in this day and age, hypertension is a big driver of many adverse events like stroke, heart failure, kidney disease, and early death. So this concept of hypertension being a benign condition is not true, and the incidence of hypertension actually even in the young and old alike is rising as the days pass. So this is definitely a silent killer. It is something that we don't really associate with immediate danger, and that's what makes it a big killer of young and old people alike in this day and age.
So, why is it called the silent killer?
Many a times people don't have obvious symptoms of having elevated blood pressure, and many a times whatever symptoms they have, they are not actually always associated with hypertension. So many a times the symptoms are either absent or they are vague and very non-specific, like some vague uneasiness or headache, which can be for reasons other than hypertension as well. So that's why it's difficult to diagnose purely based on symptoms. Many other cardiovascular conditions are there which produce symptoms which are very typical of those conditions, but hypertension unfortunately is silent most of the times unless you go and check your blood pressure readings.
So, doctor, my next question is what's different how clinicians are managing hypertension today?
Yes, so the so much discussion about hypertension today in our field is occurring because many things have changed. There are many paradigm shifts which have occurred in hypertension care and management. Earlier, like we used to concentrate on single office blood pressure measurements. It was more like we were treating the numbers. So nowadays, it's become more like of a personalized care where you take the whole cardiovascular risk of individual patient into account and not only the blood pressure readings. So that is something which has changed. Also, what has changed is with the advent of technology, we are using technology more in our field. So there are digital tools which have developed which help us to monitor and track hypertension better. And that is actually really changing a lot of things in our field compared to what we were doing 10 or 15 years earlier.
So, in 2025, the medication or the way of treatment is changing?
Yes. So, like I said, the medications, there are new medications and there are new interventions or procedures also which have come up. But the basic ways and means of evaluating of patient with hypertension, even that has changed. So, like we are, for example, we are focusing a little bit more on measuring out of office BP measurements. So, earlier the concept was that a patient would come to us and we would measure the BP. Sometimes the clinician himself would measure the BP, and that was the basis for starting or delaying treatment. So, nowadays we are focusing more on home BP or out of office BP. So we are advising patients to measure their BP at home or using something called as ambulatory BP monitoring. So the patient keeps on ambulating or walking about or doing normal activities of daily living, and the BP keeps on getting monitored. So all of these are giving us a lot of information about different patterns and different types of hypertension. So there are some patients who have something called as masked or hidden hypertension. There are some patients who you will have heard of, they have high BP readings only in the doctor's chambers, which is called as white coat hypertension. And there are some patients who have hypertension which is manifested by hypertension only at night time. So these are different patterns of hypertension which we can only find out if we are monitoring the BP at home or monitoring while the patient is ambulating. So these are it's not only the treatment, it's also the way we are approaching patients and diagnosing them that has changed.
So, doctor, my next question is, do apps and tools actually helps people in managing hypertension?
Yes, so nowadays we are getting this more and more focus on using apps and different types of tools which will help us to monitor and track hypertension and also see how it responds to treatment. So there are various ways technology is being used in our field, especially where hypertension is considered. So you nowadays, you almost everybody has some sort of smart device with them. You can use simple apps which can help you to track your hypertension. There are apps which also prompt you to take your medicines regularly or prompt you to take your BP readings, home BP readings regularly. So these, when patients have this information, this data, when they come to the clinician, and the data can be actually used by the clinician better to give tailor-made therapy to the patients. So the key word nowadays is that, like I was saying, it's individualized or personalized care. And that individualized and personalized care can only be delivered if you have individualized data sets of each and every patient with you. So that's where digital health or digital tools are helping us.
So, are these tools actually reliable to use?
So the thing is that there are certain nuances when we are using newer tools or newer devices. So suppose nowadays you might have heard that nowadays smart watches or there are smart rings or different sort of cuffs which can be used to monitor or measure BP. Sometimes these devices are not validated in well-made clinical trials. That is true, but they still work in ways that are very interesting. So, for example, suppose if I give you an example, a 42-year-old young software professional comes to me with a smart device which has given an alarm that the device is showing high BP or high pulse rates. So when this patient comes to me very apprehensive about the readings, so do I start medication straight away? So no. So what I do in these patients is that I tell the patient to get a validated BP measuring instrument and use that measure instrument to take regular BP recordings at home for the next, say, 1 week or 2 weeks or 3 weeks, and come back to me with those readings. So in this particular patient, I find that the pulse rates and the BP is all actually within the normal range. So that device was maybe not showing the correct diagnosis of hypertension. But when I go back again and look at the readings, I find that most of the spikes of BP which the device was picking up was actually in the night time when the patient was engaged in some work session. So it gives me a pointer where I can start some discussion with the patient about his lifestyle, his stress, or his sleeping patterns. And in that way, you can impact the health of that person. So it's just, you can say in a way, it's a conversation starter. But you can't obviously use these devices as alone, as standalone devices, at least at this moment.
Absolutely. So, doctor, what happened when BP is still high despite of lot of medications?
Yes. So there are terminologies like difficult to treat hypertension or resistant hypertension, which basically means that even after giving multiple medications, generally 3 or 4 medications to reduce BP, the BP still remains high. So it is resistant to treatment. And these particular set of patients are actually very difficult to treat sometimes. because obviously because your BP is not getting controlled, and that impacts on, say, your heart health or kidney health or brain health over the long term. So resistant hypertension management, we have nowadays some new approaches to treatment which are actually very exciting. So for example, there are newer medications which are coming up. For example, there are aldosterone synthase inhibitors, certain newer medications which are coming up, which have shown very exciting new data. So there are new medications, of course. We as interventional cardiologists, we now actually have procedures which can actually help to reduce BP. So there is a particular procedure which is called as renal denervation. So we actually ablate, or in a way destroy the nerves which give impulses to the kidney, and doing that actually helps to bring down blood pressure gradually. So in patients who are taking multiple medications, you can actually use this procedure in select group of patients to improve your BP outcomes. These patients sometimes have other conditions, secondary causes, which lead to the BP becoming resistant to treatment. For example, sleep disorder breathing, or something that we call as sleep apnea. This is very under recognized, but it can actually make control of BP very difficult. Of course, worsening kidney disease, those are other conditions which can happen. So there are secondary causes which need to be ruled out. There are procedures, and there are newer medications which are coming up, which are now helping us treat this difficult subset of patients. There is also something called as cardiometabolic management. So many of these patients, we now prescribe drugs which we earlier used to prescribe for diabetes control or weight management. So you'll recognize many of our patients have weight which is on the higher side, and actually using medications which help in weight reduction, actually we find that there are ancillary benefits like lowering the BP and also lowering cholesterol and other parameters as well. So there are many things happening in resistant hypertension sphere as well, which are very exciting and gratifying for patients as well.
So, are the new medication changing the landscape?
Yes, obviously. So the newer medications as well as the newer procedures. Earlier, say 10 or 15 years before, we did not have very many options actually. We had to accept whatever BP was achieved with the maximal medical therapy. Nowadays, we have newer medications which we can try. We have ancillary medications like, say, weight lowering medicines. And in certain select cases, we also have procedures that can be done to help BP control. So yes, all in all, there are newer hope. There is new hope for patients who have actually difficult to control or resistant hypertension.
So, lastly, doctor, what you want to tell our viewers about hypertension?
Yes. So what I would like to get across to our viewers is that there are so many exciting things which are happening in hypertension control, which actually are giving very gratifying results. So whenever suppose somebody in our audience, our viewers, if they have been diagnosed with hypertension or they suspect that they have hypertension, and if they go to their clinicians, there are few things that I would suggest that they should ask their clinicians as to what is the target BP that they should try to achieve, what is the overall cardiovascular risk that they are exposed to, is there any way of estimating that, how do they correctly measure their BP at home, what are the new tools, what are the new devices, whether all the devices are equally effective or validated, and how do they keep track of their BP measurements. And lastly, what I would like to tell them, and what I think almost every patient or listener will come and ask to the doctor, is what are the lifestyle measures that they should follow. So the main lifestyle measures that we should follow actually, so that our BP stays in control and overall cardiovascular risk also improves with the same measures. First of all, obviously, is that we need to exercise regularly. Everything starts from that. At least 5 days a week, at least half an hour of exercise every day for 5 days a week is absolutely essential. A sedentary lifestyle is very dangerous. It's like you must have heard that it's equivalent to smoking as a cardiovascular risk factor. We need to keep our weight in control. So measure your weight, find out what your weight is supposed to be for your height, and try to keep it within the healthy range. Diet is very important. We all know that salt has to be restricted, but what is not appreciated is maybe that the other factors like increasing the fiber content in your diet, taking fruits and vegetables, increasing the amount of antioxidants in diet is very important. Risky behavior like smoking or alcohol needs to be curtailed, and also sleep. Sleep is very important in today's stressful lifetimes. It is very important to take care of sleep. At least 7 or 8 hours of uninterrupted healthy sleep is very important. Other than that, there are hidden factors which can actually lead to the difficulty in controlling hypertension. These are for the clinicians to diagnose and manage. However, the bottom line remains is that in 2025 there are so many new things happening in hypertension. There are so many options that it's really an exciting time for both doctors and clinicians, and we can actually hope to give a good cardiovascular outcome to almost every patient of hypertension who comes to us. The key message is to diagnose this early and not delay the initiation of treatment.
Absolutely. Thank you so much, Doctor, for your
Thank you.
advice. And see you all in the next episode very soon. Till then, stay hearty and stay healthy. Thank you.